We know that delays in cancer diagnosis have a huge impact on patients in the NHS. In England, it is estimated that 46% of all cancers are diagnosed at a late stage when treatment is less effective. If cancer is diagnosed early in general practice, it can mean that patients have more treatment options, improving the chance that treatment is successful. Patients sometimes visit their GP practice with vague and ambiguous symptoms, and there can be uncertainty about the causes of symptoms and the diagnosis. In these situations, patients might be asked to monitor these symptoms and return if necessary. This is often called safety netting. However, patients are not always sure what symptoms to keep track of, for how long, and when it is appropriate to book a return appointment. This can lead to delays in diagnosis. Patients can play a central role in achieving a more timely and accurate diagnosis by effectively monitoring their symptoms and booking a return appointment if necessary. This is what SNAP, Shared Safety Net Action Plan, is all about. The Yorkshire Quality and Safety Research Group and colleagues at Sheffield Hallam University have worked with patients and staff from general practice surgeries to develop SNAP. SNAP is a safety netting tool that can be used in general practice consultations when it is not clear what might be causing symptoms. SNAP creates a personalised plan to help patients keep track of their symptoms by specifying what they need to monitor and when to get back in touch if their symptoms continue, get worse, or if new symptoms appear. SNAP can be linked to current NHS electronic systems so all the appropriate colleagues in general practice can access it. Let's take a look at how SNAP works in a bit more detail. Rena is a doctor who works in a general practice surgery. Rena sees many patients with a variety of health concerns, and some patients might have symptoms where the cause is unclear. This is the case for Dave today, who has had an upset stomach and has been feeling more tired than usual for 3 weeks. After asking Dave more about his symptoms, Rena is not sure what is causing Dave's tiredness and stomach upsets. Together they need to make a plan so Dave can keep track of the symptoms Rena is concerned about. Rena is able to make a personalised plan with Dave by selecting the symptoms he needs to keep track of. Rena also adds how long Dave needs to keep track of the symptoms and when he should contact his GP again if his symptoms continue or get worse. In Dave's case, he needs to keep track of his stomach pain, diarrhoea and tiredness for 2 weeks. If after 2 weeks these symptoms have not improved or gone away, or if new symptoms appear, then Dave needs to come back and see a doctor again. This personalised plan is saved in Dave's electronic NHS patient record. Rena can also send Dave an email or text message with his plan, or print a copy of the plan for him to take away. Now Dave leaves the appointment with his personalised plan in hand, and he knows what to do and when to come back. As Dave's personalised plan is saved within his NHS patient record, it is available for other doctors, nurse practitioners and other practice colleagues to access if he does book a return appointment. There are lots of potential benefits of SNAP. SNAP shows what symptoms a patient needs to keep track of, along with a clear timeline and when to get back in touch with their practice. It reminds people in a simple way of what they need to do. It also supports GPs and nurses in times of uncertainty to record symptom information supported by a specific safety netting process. We hope it will facilitate personalised, more specific safety netting and help empower patients to monitor and review their symptoms. When GPs and practice nurses use SNAP, it could help them to reduce delays in cancer diagnosis. In the long run, this has the potential to improve treatment options and save lives.